Hello everyone, it's me Dr. Zainab and I hope you are having a great day. Today I am here with our new topic, that is the internal iliac artery. In our previous lectures we talk about the abdominal aorta, its three anterior branches, that is celiac trunk, superior mesenteric artery and inferior mesenteric artery. One of that visceral branch, that is renal artery. And today we are here with our new topic, that is the internal iliac artery and its branches. Okay, so let's start our topic. Here you can see that this is the abdominal aorta. It gives many branches, and at the level of its bifurcation, which occurs at the level of L4. Okay, so at the level of L4, this abdominal aorta bifurcates into right and left common iliac artery. Okay, right and left common iliac artery, and then this right and left common iliac artery, they further divides into the external and internal iliac artery. Okay, as these right common iliac artery and the left common iliac artery, when they passes in front of sacroiliac joint, they divide into external iliac artery and the internal iliac arteries. Okay, and today our topic is internal iliac artery. In our next topic we will talk about the external iliac artery. Okay, so if we talk about the internal iliac, it is further divided into anterior and posterior division. Okay, I told you that at the bifurcation of the abdominal aorta, there arises right and left common iliac artery, and when this common iliac artery passes in front of the sacroiliac joint, it divides into external and internal iliac artery. Okay, now this internal iliac artery, just above the margin of the sciatic foramen, it divides into its anterior division and the posterior division. Okay, and its anterior division has some branches and its posterior division has some branches. Okay, so now we will talk about the branches of the anterior division of the internal iliac artery. Okay, these are very simple. You just have to remember that this internal iliac artery and its anterior division gives off superior vesical artery. Okay, if it gives superior, then it also gives inferior vesical artery. Sorry, it's not gluteal, it's inferior vesical artery. Okay, so superior vesical artery, inferior vesical artery, middle rectal artery. Okay, as you know that the superior rectal artery which supplies the rectum, major part of the rectum, is a branch of inferior mesenteric artery. Okay, and this middle rectal artery, it is a branch of internal iliac artery. Okay, this is very important MCQ, and it's oftenly asked in many vivas. Okay, so anterior division gives of superior vesical artery, inferior vesical artery, middle rectal artery, obturator artery. Okay, which supplies the obturator compartment of the leg. Okay, then uterine and vaginal artery. Okay, so these are the branches, and its two terminal branches, that is the internal pudendal artery and the inferior gluteal artery. Okay, these two are the terminal branches of anterior division of internal iliac artery. Okay, here I want to tell you that this inferior vesical artery, okay, this is not gluteal, this is vesical. Okay, vesical or vesical. This inferior vesical artery, it is not present in females. It's one branch, that is the prostatic artery. It is present only in males. Okay, as you know that prostate is present only in males. So this inferior gluteal artery, it is inferior vesical artery, this is only present in males while it is absent in females. Okay, and if we talk about uterine and vaginal artery, then you better know that it is present only in females and it is absent in males. Okay, now if we talk about the posterior division of internal iliac artery, then the posterior division of internal iliac artery also gives off some branches, and that are 3 in number. Okay, internal iliac artery anterior division 7 branches, while the posterior division, it gives off 3 branches. Okay, and its 3 branches are superior gluteal artery. You can see here that inferior gluteal artery, it is a branch of anterior division of internal iliac artery, while superior gluteal artery, it is a branch of posterior division. Okay, and overall these both are the branches of internal iliac artery. Okay, So posterior deviant gives superior rectal artery, lateral sacral artery, and iliolumbar artery. Okay, this iliolumbar artery supplies the it is present in the pelvis, and then it ascends and supplies the area around the L5 vertebra. Okay, so this was all about the internal iliac artery and the branches of internal iliac artery. These are very simple. If you have any question, you can ask. Thank you so much.